Quick note: this is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and Medline Plus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. Struggling with mystery allergies and sky-high medical bills? Allergy skin tests are one of the most common diagnostic tools doctors use, but many people have no idea what they actually cost or how they work. Plus, in 2026, you've got more options than ever: traditional doctor's office testing, telehealth consultations, and at-home kits. In this video, we're breaking down the real costs, walking you through exactly what happens during the test, and showing you where to order online if you want to skip the office visit. According to Mayo Clinic and the NIH, an allergy skin test is one of the quickest ways to identify what you're actually allergic to. Instead of blood work that takes days, you get results in about 15 to 20 minutes. The basic idea: the allergist applies tiny amounts of common allergens to your skin: pollen, pet dander, dust mites, food proteins, and watches for a reaction. If a bump or redness appears within 15 minutes, that's a positive result. It's simple, fast, and far more accurate than guessing. Here's what actually happens when you show up. The allergist usually tests your forearm or back, applying about 20 to 40 different allergens at once. They mark each spot with a number, apply a tiny drop of allergen extract, then use a sterile lancet to gently prick the skin. You wait 15 to 20 minutes. If you react, you'll see a raised bump called a wheal and redness around it, like a mosquito bite. The allergist measures the size and compares it to a control spot. No needles, no blood, minimal discomfort. According to Cleveland Clinic data, a typical allergy skin test runs between $200 and $1,000, depending on location and insurance. Without insurance, expect $300 to $600. If your allergies are covered under your plan, many insurers pay 80 to 100% after your deductible. Regional variation is huge. Urban areas cost more than rural ones. The number of allergens tested also matters. Testing 20 common allergens costs less than testing 60. Some urgent care centers offer it cheaper than allergists, though comprehensive testing is more thorough at a specialty practice. In 2026, you have choices. Traditional in-person: you book an allergist, come in, get tested same day or within days. Pros: results in one visit, direct expert interpretation, full treatment planning. Cons: higher cost, office wait times, time off work. Telehealth route: consult a doctor online, discuss symptoms, get a prescription for an at-home test kit. Pros: cheaper, flexible scheduling, privacy. Cons: you don't get real-time results, you have to do it yourself. Interpretation takes longer. Both are legitimate. It depends on your symptoms severity and your budget. So what's actually available online in 2026? Companies like Everlywell, Let's Get Checked, and Everly Health partner with licensed allergists to mail you test kits, though most at-home allergy tests are serum tests, not skin tests. You prick your finger, send blood to a lab, and get results in 3 to 7 days. Medline Plus notes, these are less sensitive than in-office skin tests, but more convenient. Telemedicine apps like Teladoc and MD Alive let you consult an allergist who might recommend one. Costs are typically $100 to $300. Accuracy matters. According to the NIH, skin prick tests have about 80 to 90% sensitivity and specificity for common environmental allergens. They're considered gold standard. At-home blood tests run 70 to 80% accurate. A positive result doesn't mean you'll have a severe reaction. It means your immune system responded. A negative result usually rules out an allergy. The allergist looks at the size of the wheal and talks through symptoms with you. Context matters. Never use results alone to start avoiding foods or treatments without discussing with a medical professional first. You should consult a healthcare provider if you have chronic sneezing, itching, swelling, or mystery rashes that antihistamines don't control. If you've had a severe reaction, anaphylaxis, or throat swelling, don't wait for an at-home test. Go to urgent care or an ER first. Medline Plus recommends skin testing when symptoms affect your quality of life, and over-the-counter treatments aren't helping. Your doctor will determine whether a full allergy panel is necessary, which specific allergens to test, and whether you have other conditions mimicking allergies. That conversation is crucial before you order anything online. So here's what you need to know. Allergy skin tests are fast, accurate, and costs range from $100 to $1,000 depending on where you go. You've got options: traditional in-office testing, telehealth consultations, or at-home blood tests. Don't self-diagnose based on results alone. Talk to an allergist for proper interpretation and treatment planning. You can find links to trusted testing platforms and telemedicine services in the description below. What type of health tests are you interested in? Comment below and we will make a video about it.